We just have the right climate that induces more pollen in comparison to other places. So you'll see more pollen more in the central area of the state as far as Dallas, Houston, Austin, San Antonio, in comparison to, say, Brownsville, El Paso, more West Texas. So we're more prone to getting those big fluctuations as far as spring with the springtime trees and grasses, and then those big fluctuations in the fall with the weeds. Central Texas in particular, we're known for high pollen counts with mountain cedar, which is a pollen that's unique to here in Central Texas. So we get a lot of glamour because of that, and a lot of patients are sensitized to that just based on other cedar exposures, maybe in potentially other locations. We'll have a lot of patients that, say move from out of state from other places that may have been exposed to Texas allergens in the past where they've developed antibodies, say as a child, and then they move here. Generally, it takes about a few years as far as seasonal exposures for patients to develop symptoms. So generally the kind of picture we see is, someone say they move from California for college or for a job. They may live here a few years and not have a whole lot of problems. And then generally just basis of developing antibody sensitization against the new pollens that they're exposed to, then they'll start to have issues. So when I'm looking to manage allergies, I divide it up into 3 different buckets as far as to manage allergic rhinitis and allergic conjunctivitis. So the first one is avoidance, as far as avoiding particularly what's positive on skin testing. And there's different ways to go about that with, dust mite encasements or wearing a mask and showering after outdoor exposure if pollen's an issue. The second bucket is medications. So those could be over-the-counter medications or prescription medications. The most common would be oral, antihistamines such as Zyrtec, Allegra, Claritin. The more effective are actually the nasal sprays. Nasal steroids are generally used on a daily basis to help prevent symptoms, and nasal antihistamines are more on an as-needed basis. And then we even have some that have nasal sprays with both of those components in there. And then our third bucket is really what we would call immunotherapy, or changing how your immune system responds to the allergen. And there's different modalities to go about that. So the one that's been around the longest is allergy injections. So that's where we would take everything that's positive on your skin test, mix it into a vial just for you. We start at baby doses and slowly increase how much we're giving until we get to kind of a dose we're not changing anymore. And that's where we would expect changes within the immune system of how your immune system is responding to those allergens. So it's as close as we've gotten to a cure for allergies.